We're now going to have a series of conversations focused on the health and well-being of future generations and policy, an important theme that we have been highlighting through our programming in support of the Biden-Harris administration national strategy on hunger, nutrition, and health. The next couple of conversations will look at the legislation and programs that can increase the access and affordability of healthy foods, especially for children and their families. And for this first conversation, I'm a little verklempt because it is my honor to welcome Admiral Rachel L. Levine, the Assistant Secretary for Health at the Department of Health and Human Services. Admiral, it made me so happy and cry, honestly, tears of joy when you said you were be able to join us. So thank you for being such a heroine, such a trailblazer, and thank you for joining us all today. Please give her a round of applause.
Thank you very much. I'm really pleased to be here.
Thank you so much. So to start, I'm really hoping that you can tell me what drew you to this work that's really focused on developing healthy, nourished, which is a word I love and use a lot, communities.
Well, thank you very much for that question, and the focus of this whole symposium is really fantastic. Well, healthy food, nutritious food is a human need. Actually, it's a human right. Thank you, yes. And we can't address hunger, nutrition, and health without viewing them all holistically together.
Right.
That's absolutely critical. You know, I've seen this firsthand. I know storytelling is something that's important to you all in my travels. So one trip was to East St. Louis, which is actually in southern Illinois, where they have a significant nutritious food desert. Yeah. They have a very poor community, underserved community, lots of different environmental challenges, and they have no grocery stores. They have no access to fresh fruits and vegetables. They have corner stores which have been taken over and sell primarily fast food. Right. And they have lack of transportation, trouble with housing, and they have no access to nutrition food. And we have a round table there with Jackie Joyner-Kersee, who I remember very well from the Olympics and who is from that community, and they were talking about the challenges. And a couple of the kids that were in the round table were young people, and I'm a pediatrician by my original training, and they really challenged us. Like, this is, how could you live here? And this is unsustainable. And really hearing those young people talk was very meaningful to me. The second story I'll tell, though, was in another part of the country, in Alaska. In rural Alaska, up near Utqiagvik, which is the top of the world, and other remote Alaskan native villages, where they're having significant impacts to their native food because of the impacts of climate change and pollution. Their native foods are so important to them from a nutritional aspect, from a health aspect in terms of avoiding chronic diseases, but also it is intimately part of their culture, and it's threatened, and we heard from the communities up there. So I see this in all the travels that I go on.
It's so exciting that there's this groundswell, and it's from the ground up, it's from communities themselves. What's exciting to me is that the government is taking this holistic sort of viewpoint. That's a revolution in the federal government. Can you talk about that?
Well, we are trying to be really transformational in the federal government, in the Biden-Harris administration. And in my department, under Secretary Javier Becerra, the White House Conference on Hunger, Nutrition, and Health happened in September of 2022, coming off part of the acute phase of the pandemic. And it showed the real importance of this transformational change. And it showed how all of these different issues are related. Many of the different challenges that we have are related in terms of aspect to healthy, nutritious food, but then the transportation necessary to bring people to that, housing, education. I just saw, no food without farms outside, right. Rural areas, agriculture, all of it is related together to form what we are calling now thriving communities. Thriving communities.
What is also exciting to me, and you mentioned this just a few moments ago, is that you're making these connections. It's not just about food and nutrition, it's about climate change, it's about pollution, it's about all of these other things, which I don't think that the federal government has made those sorts of, connecting the dots before. That's great. That makes me feel patriotic.
I agree. And so we have a new initiative called People and Places Thriving that I'd like to highlight in that regard.
Please.
And it is really across the federal government. It is not just the Department of Human Services. There are actually, I'm looking up like 47 different agencies and departments involved with this initiative. And to me, this is an evolution of the social determinants of health. And it relies upon working on what we call the vital conditions of health, nutrition, well-being, and justice. Health, well-being, and justice. And nutrition is an absolutely critical aspect of that. Not just food security, but the USDA has coined it nutrition security. And this is breaking down silos across the federal government. It used to be called equitable long-term recovery and resilience. Didn't flow off the tongue as well as it could. It had an acronym, of course, ELTRR, because everything in the federal government has an acronym. So now it has been reimagined as People and Places Thriving. And we're really excited about this transformational initiative.
The word thriving is very important too. It's not just about surviving. It's not just about getting enough calories. That's a very particular, we talked about semantics in an earlier panel. That's a very particular word to use.
It is a particular word, and it's drawn with intention, that we want people and places to thrive. I think that only happens when we're working together in communities, in families, in communities, in states, and across the country. We have to break down these silos that have developed and to really all work together to achieve this state. Now, this is a whole of government approach.
Yeah.
Again, 47 different federal agencies involved. It is really addressing health equity and the fundamental aspects going way upstream, as we like to do in public health. And this is not something that we're going to achieve in the next year or so. We're looking the long game. This is a 5, really 10-year initiative.
That whole of government approach and those 47 agencies, that can't have been easy. I know the lead up to the 2022 event, the hunger conference with the White House, that had to be a massive sort of mobilization of getting all those folks to finally break down some silos and talk to one another.
It has really been a labor of love, and it has originated actually in the first year of the pandemic, kind of stealth, with career employees who saw that, well, we need to look eventually beyond the acute phase of the pandemic, and to look about how we pull together and recover, and then develop resiliency within our communities. And that has led to this ground-up effort from our fantastic federal employees. Yeah. It has gravitated to a couple different offices, but when I came in 2021, it had landed in my office, and I have tried to really nurture this transformational initiative.
Well, you mentioned the pandemic, and I think that has been so important to this sort of food is medicine idea, gaining so much momentum, and it's really only growing. And I'm wondering if you can talk about how the Department of Health and Human Services sees food as medicine as a policy driver now.
So it absolutely is a policy driver. It is critically important to, again, our Secretary Javier Becerra, looking at it as a health equity issue. And again, you cannot separate the battle against hunger from food as medicine from a health equity perspective. They are really intimately related. So we're working in all the different divisions at HHS. For example, the Center for Medicare and Medicaid Services is incentivizing providers to screen patients for food and nutrition security, as well as other challenges, housing instability, transportation difficulty, interpersonal safety and violence. It really is part of health to screen for these specific issues. CMS has announced approval of 1115 Medicaid waivers in Massachusetts and in Oregon, and we're starting to do that in other states, which really is part of this initiative to end hunger, but also to end hunger, reduce chronic diseases that are related to diet and nutrition, and to eliminate health inequities. They are all intimately related together.
And I wonder how you're working to educate communities about those 1115 waivers, because that's part of this process.
That is, and so we have a Food as Medicine initiative at my office of the Assistant Secretary of Health that is working with these communities, trying to advance this concept of food is medicine. And we're trying to create an integrated virtual platform that will sort of allow communities to understand the landscape and how the impact is, and to work with states, with communities, and the federal government collaboratively together, which I know is radical, but that's the way we do it.
So important to get that information out there. So the HHS just hosted its first Food is Medicine convening in Washington, D.C. I was very excited to be there. I was excited to be in that building. I'd never been in there. I'm wondering if you can talk about the inspiration behind that conference and why it was so important, and why it was so important to have it in that building.
Well, it was really the first conference of this size. It was the largest conference that HHS has ever had. We had 500 people in the building, in the Great Hall, which I'd never seen full before this effort. And we had 2,000 people online, and the inspiration came from our secretary, that we wanted to have a landmark conference bringing stakeholders from throughout the country together, right to the Hubert H. Humphrey building, right to, in all of its brutalist architecture wonder, and right there in the Great Hall to discuss about this important initiative, this important health equity initiative. And I think that it was landmark, it was inspiring, but it's just a start. You know, you have a conference. The conference is not the end of things. The conference is the start of things.
Right. And it wasn't just federal agencies that were there. There was very bipartisan support. There were members of Congress on both sides who were there really excited about this work, promoting it, drinking milk on stage, doing some weird things that I never would have thought of. But it just wasn't Jim McGovern, you know, a hungry
That's
hero.
exactly right. So we do appreciate Congressman McGovern's work on this from Massachusetts. But you're right. This is a bipartisan initiative. What could be more bipartisan than food, than nutrition and health? To me, these are all bipartisan issues. None of this should be political in any way.
Absolutely. Thank you for saying that. Admiral, we can't talk about these issues, I think, without talking about scale. How do we scale up the food as medicine work? How do we make sure that other federal departments, and I know you're all trying to work together on so many things, really support it and get the momentum behind it? Well,
so you're right. This has to be a whole of government approach, because there are transportation issues, there are housing issues, there are educational issues, there are labor issues, there are obviously agriculture issues, and we all have to work together in terms of this to be successful. I think that we need to break down silos. We need to make this bipartisan. We need funding. So more funding is absolutely critical. So right now, with our People and Places Thriving, we're working with existing resources and existing capabilities that we have. But in order to continue to move the needle in terms of dealing with food and nutrition security, and to end hunger, and to advance food as medicine, we're going to need more support and more funding as well.
Sure.
And, you know, I'm a positive and optimistic person, and I think that's going to happen.
Bravo to that. You said that funding is so critical, and I'm not sure if you can answer this question. You can tell me no and walk off the stage if you'd like, but this is an election year. And how do we get that bipartisan support that is so necessary to make all of this possible, to increase the thriving and well-being of so many Americans who need it desperately?
Well, you know, the president and the vice president and our secretary and others are really trying to do this every day. So we want to make this a bipartisan effort, even in lean fiscal times. We have to address public health challenges that we see, and we have to address these issues of nutrition and food, nutrition security, food as medicine, and public health. So I will remain hopeful that as budget talks continue, that these issues will remain fundamental and can draw bipartisan support for more funding.
Yeah, if this issue can't do that, nothing else can.
Well, we're going to stay positive and optimistic that it can.
I will stay with you right there in that optimism. I'm wondering what your call to action is for everyone in this room, and what do you want everyone to take away from this conversation?
Thank you. You know, this really is a call to action, and it's not just a call to talk. It's a call to action. I think we all have to work together. You know, the COVID-19 pandemic, it's hard to imagine that it was March 2020 when all of our lives changed. It was 4 years ago in terms of the acute phase of the pandemic. But the challenges of the last 4 years have taught us that we are all interconnected, is that our health and our well-being fundamentally rely upon us working together in that spirit of connectedness. And I really believe that spirit of connectedness is what makes our country great. And it's what we have to work on now more than ever. And this topic that we're talking about today, about food and nutrition security, ending hunger, food as medicine, addressing chronic illnesses, public health, really is the perfect example of how we can come together to really create that thriving community, that thriving nation, and really this thriving world that we all need and that we all deserve. We must do better. I truly believe that we can do better, and with all of your help, we will do better. Thank you.
Thank you so much, Admiral. What an honor to meet you. Thank you. I am so grateful that Admiral Levine could be here with such a busy schedule.